Hey guys, I'm Siobhan, a second-year medical resident. So how many of you guys have ever watched videos on the subreddit group, What Could Go Wrong? Basically, they're fail videos and they're hilarious. But you know what? As a doctor, you simply can't turn off that medical side of your brain. So I'm always thinking about the types of injuries that these people could be getting. Okay, let's find some good ones. Fully grown man on a swing. Okay, let's see. Okay, he's got his friends around him and he is tucking his phone away safely. Okay. People are videotaping him. I feel like when people are in a group, he's more likely to amp up and do something silly like that. Oh my gosh, that makes me so nervous. I'm really scared of heights. I hate this. Oh my gosh, this is my nightmare. Oh gosh. Okay, number one concern is for a head injury. I think there's a pretty high chance he could have gotten a concussion, and that's really a mild traumatic brain injury. And symptoms could be anything from like a small headache to pretty serious memory issues, concentration problems. So when I'm in the emergency department, I'm looking out for red flag symptoms. Things that make me think this is more likely to be a severe head injury that I don't want to miss. So things I ask patients about is if they've had any loss of consciousness. So if they can't remember something, I'm more concerned. If they've got a severe or worsening headache. If they've got clear liquid running from their nose or their ear, they might think, oh, I just have a runny nose. But I'm worried, could they actually have a fracture in their skull, and could this be spinal fluid that's coming out of their nose? So basically, if you get a head injury, you should see a doctor to get your symptoms checked out. They can decide what tests need to be done next. It needs to be taken seriously. Okay, let's check out this next one. Okay. Is she kissing or is she... Oh man! Okay, I really see that she's smiling at the end of that. Okay, so I'm definitely most worried that she got some of that spit from the llama into her eye, and maybe she could get an eye infection. In saliva, there is a ton, like hundreds of bacteria and fungi that live in our mouths and all animals. And most of the time, if you're healthy and you have good oral hygiene, it just doesn't bother you. You don't even know they're there. But if that bacteria or the fungi gets somewhere else, like in your eye, you can get an infection. The difference between your eye and other parts of the body is other places you've got skin, which is a natural barrier so that bacteria can't get in there, and you've got all these white blood cells waiting underneath the surface that can eat up the bacteria. So we have our eyelids to blink, and we have tears that wash away any particles that get in there, but otherwise, there's not as much protection and it's easier to get an eye infection. So hopefully this lady was able to blink in time, but otherwise she should probably go and wash out that llama spit. Okay, this one looks like it's about parkour, which always terrifies me when I'm watching it because I hate heights, but let's do it anyway. That makes me so uncomfortable. Why would you ever go to that height on purpose? And jumping, he could have really hurt himself. Okay. What's he doing there? Oh! Is that that's a rusty pipe. That's the doctor in me. It's like immediately, oh no, tetanus! Whether or not that's his biggest problem, maybe he broke something from falling, he could have scraped himself up, but for whatever reason, the first thing that comes to my mind is tetanus. So tetanus is a disease that's caused by a bacteria called Clostridium tetani. And it's found all over the place, in soil, manure, even in your saliva. And classically, it starts with sort of locking of the jaw, like a spasm, and it's actually called lockjaw by a lot of people. And then progressively, it has these spasms throughout the body. There's actually a really famous painting by Sir Charles Bell back in the early 1800s, and it's supposed to be a patient who's having these muscle spasms because of tetanus. You can tell from that painting it's a really serious condition, and up to 10% of people who have it will die. That's because you get the same spasms in the muscles that control your breathing. That's why it's so incredibly important to stay up to date on immunizations and get a tetanus booster every 10 years. So there's a really weird test called the spatula test that helps you tell if someone has tetanus. What you do is you take an actual spatula, you put it into someone's mouth to the back of their throat, and if they gag, that's considered normal. But if they instead clamp down with their jaw and they didn't even mean to, that's a positive sign that suggests tetanus. To be honest, I've never actually done this test. And honestly, I don't even know where you would find a spatula in the hospital. Could probably use something else, but yeah, it hasn't come up yet. Okay, next one's called, let me do a bowling trick shot between my legs. What could go wrong? All right, let's see. Oh man, okay. So that one, it really looks like he might have injured his lateral collateral ligament and his ego. Oh. So if this is your knee, it should work like a hinge, right? Like it just goes in one direction. And it shouldn't go side to side. Your knee doesn't go side to side. So if you get hit from the side and it goes, this ligament right here can get stretched and it could snap, or you can get a strain to it. Either way, that's the most likely location of injury here. A more serious injury would be a fracture, like a break in the bone, and so you have to go to the hospital to get that diagnosed by an x-ray. But for minor injuries like a little sprain or a strain, it's common to do something called RICE. So you rest, you ice, you compress, and you elevate the leg or the knee. But like anything else, you want to see your doctor for your specific injuries to make sure it's nothing more serious. And you don't want to compress it too tightly because that can be dangerous. And you don't want to rest it for too long because that can actually interfere with muscle and ligament healing. So really, if you're worried, see your doctor. Okay, last one. This is called Snake Selfies Will Get Me Likes on Social Media. Oh gosh, I think I know what's gonna happen here. Let's see. Oh my gosh. Okay, I think that just bit his hair. He doesn't look as concerned. He looks terrified, but it doesn't look like he's in pain. It must just be on his hair. Wow. Okay. Oh my gosh. Oh, just had to turn the light. It gets so dark so quickly in the winter now. Anyway, the important question is, what are you gonna do if you are ever bitten by a snake? Other than freaking out. So according to the CDC, you should 1, stay calm, 2, seek medical attention immediately, don't wait to see if something gets worse or the bite gets worse, and then don't try to suck out the venom, don't create a tourniquet over the arm, don't drink alcohol to try to numb the pain. Pretty much just stay calm and then just seek help quickly. When you get to the hospital, it'll be so helpful if you can remember anything about the snake. Sometimes that's not possible, but if you know the color, what it looked like, the length, the size, we can piece together with the help of your symptoms what type of snake it was and decide if you need to have any kind of antivenom, and then what kind and what dose of antivenom to give you. Yeah, scary stuff. I hope it doesn't happen to any of you guys. And to be honest, I am just so thankful that there are not a lot of snakes in Canada, so we do not encounter that a lot. But could happen when traveling, you never know. So hopefully you guys had a couple of laughs and learned something along the way. I certainly know that I will never be taking a selfie with an exotic animal. So give this video a thumbs up if you like reaction videos and you want to see more things like this. Otherwise, I'll be chatting with you guys in the comments below and seeing you next week. So, bye for now.